Hello and welcome to a quick 3-minute revision session on oligohydramnios. What is oligohydramnios? By definition, it occurs when the amniotic fluid is less than what we'd expect for that gestational age. On ultrasound findings, it occurs if there's a single deepest pool of amniotic fluid less than 2 centimeters, or if the amniotic fluid index is less than 5 centimeters. It occurs in 4% of women at term. And the pathology behind it can be divided into excess loss, such as rupture of membranes, or reduced fetal production or excretion of amniotic fluid, for example, in renal agenesis or other renal tract abnormalities. Etiology can be divided into maternal and fetal causes. From maternal causes, it could be preeclampsia, high blood pressure, diabetes, dehydration, drugs such as indomethacin or ACE inhibitors. Fetal causes include IUGR, congenital abnormalities, twin-to-twin transfusion syndrome, or placental issues such as abruption or insufficiency. The history with oligohydramnios is often it's actually asymptomatic. It might just be picked up on routine clinical examination or ultrasound. On exam, we check the vitals and just outrule any high blood pressure or preeclampsia by checking the blood pressure and urine. We do an obstetric exam and we'd find this reduced symphysiofundal height. There could be reduced Liker volume as well. And we'd also check lie, presentation and engagement of the fetus in case we need to deliver. On speculum exam, if there's rupture of membranes, we'll see pooling of fluid in the posterior fornix of the vagina. The investigations for oligohydramnios can be broken into maternal and fetal investigations. Maternal investigations on speculum. If there's rupture of membranes present, there'll be pooling of fluid in the posterior fornix. We could also consider the AmnioSure test for this. For fetal investigations, the two main ones are CTG and ultrasound. CTG just to check if the baby's in any fecal distress. Ultrasound, again, for the diagnosis of oligohydramnios. We could check the baby's growth. We could check blood flow to the baby with umbilical artery Dopplers. We may see any structural fetal abnormalities, for example, renal tract structural abnormalities. The management depends whether it's preterm or term. If it's preterm, we could do serial ultrasounds to monitor the Liker volume, growth of the baby, and umbilical artery Dopplers. We'd also check serial CTGs. We'd consider steroids as well for fetal lung maturity, and we'd deliver if further abnormalities occur. If there's preterm rupture of membranes, I'm doing a tutorial on that so you can see that section. If baby is term, we deliver it. Lastly, the complications that might occur as a result of oligohydramnios include pulmonary hyperplasia, fetal compression syndrome, placental abruption. There's also an increased risk of infection if there's prolonged rupture of membranes. And lastly, the consequences of being born prematurely. So that's it, oligohydramnios in 3 minutes.